Have you ever stopped to think about the single most incredible construction project on Earth? It's not a skyscraper or a bridge. It's the journey from a single cell to a newborn baby. Today, we're going to walk through that entire 40-week marathon, guided by the medical science that lets us peek behind the curtain.
I mean, really think about it. How is that even possible? How does one tiny cell, smaller than a pinprick, transform into a fully formed person with a beating heart, a thinking brain, and tiny little fingernails? It's a question that's fascinated us forever. So let's trace the blueprint, step by step.
All right, our journey has to start at the very, very beginning. We're talking about the moments right after conception, where the entire plan for a new life gets locked in. This is ground zero. A single sperm meets an egg, and bam, fertilization. You get a brand new, one-cell organism called a zygote, and locked inside that one microscopic cell is the complete genetic instruction manual, all 46 chromosomes, for a totally unique human being. It's all there from the very first moment.
Now, this first week is just this silent, frantic journey. That new zygote isn't just sitting still. No. It starts dividing. 2 cells, then 4, then 8, 16, and so on, becoming this little ball of cells called a morula. And it's doing all this while it's traveling, making its way down the fallopian tube to its new home, the uterus.
And then comes what might be the most important step of all, implantation. This is where the whole thing becomes a partnership. The little embryo literally burrows into the cozy, nutrient-rich lining of the uterus. It's establishing a lifeline, plugging into the mother's blood supply, which is what will sustain it for the next 9 months.
Okay, now we're officially in the first trimester. And let me tell you, this period is a whirlwind. Development is happening at a breathtaking pace. All the major organs are getting formed, and this is also when some of the most important medical check-ins happen.
Get this. By just the 5th week, what was a simple ball of cells has already organized itself into 3 distinct, specialized layers. These layers are the foundation for everything: the brain, the heart, the skin, you name it. At the same time, the pregnancy hormone HCG is surging through the mother's system, basically sending out a giant biological announcement that things are underway.
So somewhere between 11 and 14 weeks, we get to a huge milestone in prenatal care, the nuchal translucency, or NT scan. It's a simple, totally safe ultrasound that gives doctors their first real peek at some key developmental markers. And they do it by measuring this tiny, fluid-filled space at the back of the baby's neck.
Now you might be thinking, what can one little measurement really tell you? Well, it turns out a whole lot. Doctors take that measurement and compare it to the baby's size, its crown rump length, to start calculating risk. This first chart, for instance, shows how that data helps them understand the risk for major structural defects.
And it doesn't stop there. It also gives them really important information about other critical outcomes, like the risk of fetal demise.
And of course, this is what the scan is most famous for. It's a key screening tool for looking at the risk of chromosomal abnormalities, like Down syndrome. It's just amazing how much data they can pull from one simple, non-invasive scan.
Okay, this brings us to a super important point, something that's absolutely critical to understand in prenatal care: the difference between a screening and a diagnosis. An NT scan is a screening test. It's all about assessing risk. It tells you if there's a higher chance of something, but it is not a yes or no answer. For a definitive yes, this condition is present, you need a diagnostic test like an amniocentesis. Screening is about possibility, diagnosis is about certainty.
All right, as we move into the second trimester, the focus starts to shift. The initial frantic blueprinting is mostly done. Now it's all about incredible growth and refinement. This is when we get a chance to take a much more detailed look at the baby.
And the star of this trimester? The anatomy scan, which usually happens right around the 20-week mark. Think of it as the ultimate quality control inspection. It's this meticulous head-to-toe checkup where specialists examine everything in incredible detail, from the 4 chambers of that tiny beating heart to the individual bones in the spine, making sure every little piece of the puzzle is coming together just right.
So how exactly do doctors know if the baby is growing well? They use tools like this, growth percentiles. It's pretty straightforward, really. They take the baby's measurements and plot them on a chart based on data from thousands of other babies. If you fall between the 10th and 90th percentile, that's considered the normal, healthy range. Anything outside of that, either smaller or larger, might just mean they want to keep a closer eye on things.
And just like that, we're in the home stretch, the 3rd trimester.
The baby isn't building many new structures anymore. Now it's all about gaining weight and maturing those organs, basically getting ready for life on the outside. And for the medical team, it's about preparing for the big arrival, which means monitoring the baby's well-being closer than ever.
One of the key technologies you'll see during this phase, especially once labor starts, is electronic fetal monitoring, or EFM. It's pretty simple. It's usually two belts that go around the mother's belly to track two things at once: the baby's heart rate and the mother's contractions.
Now, if you've ever seen the paper that prints out from one of these machines, it might just look like a bunch of squiggly lines, but it's actually giving us a ton of information. The top line is the baby's heart rate. You want to see that hanging out somewhere between 110 and 160 beats per minute. The bottom line tracks the contractions. Doctors are essentially watching how the top line reacts when the bottom line shows a squeeze.
Okay, now I'm going to throw a statistic at you about EFM that is probably going to blow your mind. When it comes to predicting cerebral palsy, the false positive rate for EFM is over 99%. Let that sink in. Over 99%. That sounds impossibly high, right?
So what's going on here? Well, this quote from the American College of Obstetricians and Gynecologists gives us that crucial context. It tells us that EFM isn't some magic crystal ball that predicts every possible outcome. Its real, proven benefit is very specific. While it doesn't seem to change the rates of some of these scariest outcomes, it does significantly reduce the risk of seizures right after birth. So you see, it's a tool with a very specific and very important job.
And so, after 40 weeks of building, growing, and monitoring, we finally arrive at the grand finale. The journey's climax, everything we've talked about, culminates in the powerful, incredible process of labor and birth. Medically, we break the whole experience down into 3 distinct stages. Stage 1 is the longest part. That's when contractions are working to open the cervix. Stage 2 is the part everyone thinks of, the active delivery of the baby. And then there's stage 3, which is easy to forget but is absolutely vital, the delivery of the placenta, the amazing organ that was the baby's entire life support system for 9 months.
And really, that successful delivery is the result of the whole philosophy of modern prenatal care, which this quote just nails perfectly. It's a powerful reminder that this is a journey of continuous checks. Good news in the first trimester is great, but you still do the detailed checks in the second. It's a process of diligent evaluation from start to finish, all designed to get the best possible outcome.
I mean, when you step back and look at the whole thing, from a single cell to a breathing, crying, complex little person, it's just a medical and biological marvel. It's this beautiful, precise dance, and science is helping us understand the steps more and more every day. It really makes you wonder, as our knowledge gets deeper, what's the next frontier going to look like? What will we discover next about this incredible process of becoming human?